Today, we are going to be discussing a very important issue, and that is why are healthcare workers leaving the profession. My name is Ejeomah. I am a pharmacist and a digital content creator, as well as a virtual assistant. I help my clients with administrative tasks so that they can have time to do what is most important to them and their business. So if you need someone, an assistant to help you out, it doesn't matter wherever you are in the world, kindly send me a DM and let's get talking. So let's get into this very video. So why are pharmacists leaving the profession? Why are doctors leaving the profession? I would speak and I would buttress more on the pharmacy world because that is what I can relate to most. And I found out that I thought it was just in Nigeria, but when I began doing my research, I discovered that people are complaining of the same thing: being overworked, understaffed, underpaid, undervalued. This is the same reason why pharmacists are stressed out and leaving the profession almost everywhere. Let me know what your situation is like in the comments below. The first one is workload and stress. One of the major reasons why the workload is a lot is because in a given space they are usually understaffed. For instance, you will go to a community pharmacy and you expect to see maybe more pharmacists. Maybe the pharmacy is quite big enough to take in like 5 pharmacists, right? But when you go there, you only see like 2 pharmacists. So imagine 2 pharmacists are doing the job of 5 pharmacists, and pharmacy alone, especially when you're in community practice. I haven't done community practice for a long time, but from the people I've heard from my colleagues, I know that it's not something funny. There are things about being a pharmacist that make you happy. Of course, seeing your patients being satisfied, seeing your patients telling you about the progress of their health. Of course, those things make you happy when your patients consult you and you're able to counsel them and all that. Of course, those things make you happy, right? But then it takes a toll on other things. So you are being overworked. There's long standing hours, especially when you're working in community pharmacy. There are colleagues of mine that they'll tell me that they don't even have a seat to sit, because there's not even time to sit down. You have to be going back and forth, back and forth, back and forth. And imagine working a 8-hour stretch. Some people work from 9 to 9, from 9 a.m. to 9 p.m., from 8 a.m. to 8 p.m. You only get like 30 minutes break or an hour break all through. And it's not enough, and eventually it affects your emotional being, your mental being. There's physical exhaustion too. There's a lot of burnout. Most community pharmacists give you targets. You have a target every month, all those things attached to it, which makes it even more mentally draining, mentally tasking. All right, imagine someone has to deal with all this every day in hospital. Like now, when I worked in a hospital, I think you sit down a lot more in the hospital. Of course, you're still going to face the workload depending on which hospital you're working in. If you're working in government hospital, we get more patients because, of course, things are being subsidized for people. But if you work in a private place, you might not really get as much, so you might be less busy. But it really also depends whatever hospital or whatever specialty hospital you're working at. Usually, pharmacists are being overworked, and many people are getting burnt out, and they're finding and looking for a way out. Number 2 is the long hours and demanding schedule. I've already touched a part of it in the number 1, but it can be a very demanding schedule because you really do not get time for holidays. See, now people are celebrating, oh, it's Christmas, it's this holiday, it's that holiday, and healthcare workers are like, I can't relate because they are working on that day. That's why it's very important to appreciate your healthcare workers. Sometimes you don't even get a life outside of your work. Like, your life revolves around your work. It can get that bad. So imagine that you are a family person, especially if you're married, you have children. It can be really hard. And I see how the people who are married, when I was working at a hospital, how it wasn't so easy for them. Maybe some of them had already become seniors, worked in that particular facility or organization or hospital for a long time, like 5 years, to maybe they're now heads of departments. They can get breaks. But if you're just starting out in the profession, you break for what? I remember one time I was working in the hospital and I had to do night shift, and it was, I think, Christmas Day, Christmas Eve, either Christmas Eve or the last day of the year into the new year. I was in the hospital doing my night shift, and I really wanted to go for crossover. I couldn't. 3 is the low pay. If you're a pharmacist in Nigeria, you know what I'm talking about. Although in some places in Nigeria, they pay pharmacists better. From my research, that's what it looks like. So in some places, like for instance, in Abuja, pharmacists are not paid as much as they should for a federal capital city of the country, if that makes sense. So that's the most of the reasons why there is a jackpot wave. But the jackpot wave is not so easy for pharmacists because the route is very demanding, time consuming, not just time consuming, money. There's this what they call it. It takes a lot of money. You can't just go to another country just to start working there like as a healthcare worker. It doesn't work for that as a healthcare. Like for instance in tech, imagine you're a product designer in Nigeria. You don't need to write another exam to be a product designer in UK, Australia, or Canada. You just need to prove your work. They just need to like your work. You just need to create a portfolio and they love it and then they give you your job. It doesn't work like that in healthcare. Pharmacist, it doesn't work like that. For instance, if you're going to the UK, you cannot just enter into the UK. You have to do what they call OSPAP, and that one alone is money intensive. So you have to go through that. There's also limited amounts of people they take at a time, and not many universities offer that. I think in UK right now there are only like, I don't think there are up to 5 universities that offer that. I would confirm that and put that here. For instance, they still pay pharmacists, the community practice. They're giving you 100, they're giving you 120, and then you have to work almost every day, and they give you like alternate weekends, and you work back to back with the target that you have to meet, with every other thing that you have to do. I think that's a lot. They need to improve salaries for pharmacists so that they can do their work and be well compensated for it. The fifth one is health insurance or healthcare insurance. I don't know how it is in your country. I don't know. Let me know wherever you're watching this from. Is that the health insurance? I've noticed that in some hospitals I've worked in, the staff would not want to do anything in that hospital. If they want to give birth, anything that has to do with hospital bills, they go to another hospital where they have their NHS. And sometimes when I ask, they're like, oh, the things here are expensive, or they're not, And I'm just like, wow, it's not supposed to be. They are supposed to make healthcare like a lot more affordable and subsidized for people who are working there, and they should be able to make it possible that they can access anything, almost anything they want. Considering that they are the ones that are working for you, they are the ones that are working in this organization, they should get the right care that they deserve. I don't know if that happens everywhere, but I've noticed it in some hospitals, especially in Nigeria. I think we need to do better. The last but not the least is the lack of appreciation and recognition. So of course people are doing their work. Of course they love that they are doing their work, but it's one thing to do your work, and it's another thing for people to be recognized for the work that they do. Knowing that they are overworked, they're underpaid, and they're still coming to work, they're still putting their heart into it, they're still doing whatever they need to do. The pharmacy point is the last point for every patient. Like at the end of the day, when you go to the hospital, you see the doctor, you see the nurses, everything, you still have to come to the pharmacy to get your medication. So where is the pharmacist in all these things? I believe that pharmacists should be more appreciated for the work that they do, because they do so much work. Because without the pharmacy, it's not complete. The chain is not complete. So I don't know why I'm talking with so much passion. And because of this, because of what I've been noticing so far, and it feels like the government is not hearing us, I noticed that a lot of pharmacists are now looking for other ways to navigate the career. I came up with a community called Pharmunity for pharmacists in Africa, Nigeria, and Pan-African community for people who are looking to navigate other non-traditional roles and careers. More pharmacists are going into different spaces like the non-governmental organizations, and they're really doing well. I saw a pharmacist the other day, and she works with one of those international organizations, and she was narrating how she was in Geneva the other time, a Nigerian and a pharmacist, and she really enjoys the work that she's doing. Some people are going into medical writing, some people are going to just different fields, some people are going to tech so that they can merge with health. Imagine a pharmacist goes into product design and goes to a healthcare organization or even to a big pharma to be a product designer for such firm. Putting your knowledge as a pharmacist and a product, it's going to be amazing. You're going to be the best pharmacist product designer they have. That's why we have created this community called Pharmunity. If you're interested, you can register in the description box below. It's for pharmacists, but if you still want to be a part of it and you're not a pharmacist, you're very much welcome. So you can register in the description box below. So let me know what else do you think is the reason why people are leaving the healthcare profession. If you have any other topic you think I should talk about, let me know in the comment section as well. Give this video a thumbs up and have a blessed day or evening. Bye.